Hello and welcome to the presentation titled Application of the ARIMA Model to Forecast Future Opioid Overdose Deaths. My name is Joshua Raber and I'll be presenting this research. Thank you so much for joining. To start off with some background, between 1999 and 2015, nearly 500,000 people passed from an opioid overdose, including those obtained both by prescription and illicitly. Although the total number of drug overdose deaths have decreased by 4% from 2017 to 2018, overdose deaths related to synthetic opioids such as fentanyl have increased by 10%, and the overall number of overdose deaths were 4 times higher in 2018 than they were in 1999. The opioid epidemic necessitates evidence-based policies targeted at the states that are most affected by our crisis. However, the data available to inform these policies is often delayed by 1 to 2 years and therefore impedes the ability of states to create effective policies that address real-time need. Finally, this delay calls attention and highlights the importance and need for a predictive model that can accurately trend fatal opioid overdoses and thereby provide a baseline for states to implement evidence-based preventative policies from. In order to create this, we collected the rates of death due to drug overdose from the CDC, whereby their website has a map that presents data on the overdose deaths between January 2015 and December 2019. We also obtained the total population data for all states and time periods over this from the U.S. Census Bureau's website. We then combined the data set to include all 50 states and the District of Columbia. We then utilized this data to forecast opioid overdose deaths by applying the ARIMA model, which is standing for Autoregressive Integrated Moving Average. The ARIMA model is a linear regression that is able to forecast future values based on the past values of a given time series. The order of the best ARIMA in our study was found to have parameters of 511 and was fitted to the dataset obtained from the years 2015 to 2018 to forecast opioid overdose deaths with the first projected value in January of 2019. Moving on to our results, the forecasted values based on the ARIMA model performed in this research showed a steady decrease in overdose deaths from January 2019 to November 2020, representing an overall decrease of 3.7%. This is represented in graph number 1 with the red line. However, the actual data we obtained shows an increase in opioid overdose deaths from January 2019 to November 2020, representing an overall increase of 5%. And this can be represented by the blue line in graph number 1. To the left, in the center of the PowerPoint, Table 1 has actual and predicted values broken down by state and year, and the predicted values are only available for years 2019 and 2020. So that goes into more specifics. In conclusion, although the values projected by the ARIMA model deviate from the actual values for the year 2019, the accuracy of the ARIMA model in this project in forecasting overdose deaths hopefully will continue to be fortified as additional 2020 data becomes available. The ARIMA model and data presented in this presentation represent a preliminary yet invaluable step towards forecasting overdose deaths and baseline modeling data to measure the efficacy of evidence-based policy designed to address this public health crisis. Thank you so much for joining. Have a great day.